Last November, I wasn't feeling the greatest for a few days, and turns out I had a blood infection. Um, that led me to being unresponsive. My mom called 911. I was brought here and ended up having a heart attack. When they brought me back to life, my organs took a few minutes to come back with me, and unfortunately my kidneys did not return. And then that led to rhabdomyolysis. Rhabdomyolysis left me temporarily paralyzed. So I'm 35, so to be pretty healthy all my life and to have a heart attack at 35 definitely was not on my bingo card at all. When I woke up and realized I was in a coma, my first thought was, how long is this gonna be? A couple hours, a couple of days, a couple of years? Is this gonna be my whole life now? It was even more scary when I realized things like you get thirsty in a coma, you can feel pain in a coma. It's not just like you're asleep, you have all these things happening, all these fears, and you can't communicate at all. It was hands down the most painful thing I've ever experienced in my life. I'd even would rather have the heart attack again. The first few weeks were just 10 out of 10 on a 1 to 10 scale for pain. And with my kidneys not functioning, I just had a massive amount of fluid just hanging around from my waist down, from my back, my legs. My legs just look like tree trunks. The first day I met Sarah, I was not having the greatest mental day. And she had said, you know, we're gonna get you walking again. And I was like, okay, okay, sure.
When I met Eric for the first time, it was tough because I knew that I was looking at someone that was my age pretty much, and he was in very bad shape. I could read how far he had come to this point when I met him on 5B, but I knew going into this that this rehab was going to be very difficult, and to be honest, it was not looking like it was going to be a great recovery. But I wasn't going to let him know that it didn't look good on paper. He had a lot of bad days with therapy because it was showing him how little he could do. And so my job was to really highlight the things that he was able to do and to really capitalize on those positive moments, because so much of what I was asking him to do, especially in the beginning, he wasn't able to.
You kind of can pick up on how genuine people are, and that they believe in you, or that they're going to try their best to do everything they can for you. And it's not that anyone here didn't believe in me or didn't do everything they could for me, but with Sarah, Sarah believed in me when I was doubting myself.
I can remember one of the first times I went in to see Eric. He was having a rough day, and I said to him, you know, the day that you decide that you want to get better, I'm going to be your biggest advocate.
At a certain point, I started to believe as well in what she was saying. And then after I took those first 2 steps, it was just like 8 steps and 25 steps, then 100 steps. How do you say thank you to someone that does that for you? When you have so many people around you that believe in you for whatever reason they did, it makes you want to prove their trust and their belief. Right, I already wanted to do it for myself, but there's so many people around that had become more than caregivers, because I was, in here for 2 months or so, and these are just the people I'm around all day, and these are the people taking care of me, and they're getting me from one milestone to the other, and I want to make them proud as well. To have such compassion from someone that I just met a week ago, and how much he cared, because you can't fake that,
When I first met Eric, I was just getting off of my orientation, like training as a nurse, and when I first met him, I could probably say he was a patient I'll never forget.
You could tell when I was not having, the strongest emotional days. And he's a big football fan. He knows I'm a big football fan as well. And he would do things, little things that I could pick up on, that he was just trying to uplift my spirits.
I knew that it was hard because I was like a younger guy, and like we're not too far apart in age, but having someone younger than you is definitely harder to like almost expose yourself, I guess you could say. And I think it's after, like, honestly, only a couple of days, we kind of really just built this like really good friendship, so that way all of that like embarrassment or feelings of like vulnerability just went away.
On Monday nights when the football games were on, he'd sneak into my room to check the scores, and he'd say things to me like, this game starts getting good, hit that call nurse button, and we'll pretend you need my assistance. Just things to make me smile.
Just the relationship I built with him was something so great. Like, I had a relationship with him, like his mom, and I just remember he would actually make it exciting to come into work.
I just feel so strongly that, like everybody in the care team should work together, and that's why people like Eric had such a great stay here at Bay Health, because we all worked together as a team to make sure he got the care that he deserved. And if somebody was dropping a little bit and needed a break, because working with Eric was emotionally taxing, and working with patients that you care for, and to not see them progress or to see them have a bad day, it's hard on the whole team. And to be able to lean on each other, the nurses, the CNAs, the therapy staff, the physicians, even the EVS and the people that bring the food trays, everybody was involved in his care from the moment he walked in the door to the moment that he left.
Without this hospital and the people here, A, I would be 6 feet under the ground, but B, even if I did make it through that first night, I think I'd be in a wheelchair, or probably still be on dialysis. I feel like God put me at the right place, for sure. Now I'm blessed enough to have fully functioning kidneys, no more dialysis, no more catheters, and I'm doing PT 3 times a week to get my walking to normal. I'm almost there. We measured everything from when I first started PT until now. I'm like 75% better now than I was when I first started. So I feel like I'm really close to the finish line as far as being 100% healthy with no limitations to how I was before all this stuff started last November.